تفضل دكتورة.
Okay, Bismillah ar-Rahman ar-Rahim. Thank you for giving us this opportunity under the current conditions that the world is going through. Thanks also for Saudi Commission for Health Specialties and for Saudi Prosthodontic Society. I am Maram Alahmari from King Khalid University. 2 months ago, I had a patient who already had implant and she is asking for crowns. When I went through treatment plan options, I considered treating the patient with 2 techniques, digital and traditional ways. But I want to treat her according to the evidence-based dentistry approach. Why do I tell you this? Because my study is a systematic review talking about the accuracy of the digital implant impression for fabrication multi-implant supported crowns in comparison with the splinted conventional technique. If you can look at the picture, this is my case. I did 2 impression technique, one conventional splinted impression, and the other is digital impression using a scan body with CEREC Omnicam intraoral scanners. The main objective in fabrication implant supported prosthesis is making a superstructures that reveal a passive fit to avoid long-term biological and mechanical problems, which is directly dependent on the accuracy of the impression technique. A recent systemic review on the accuracy of implant impressions showed that the splinted technique is superior to non-splinted options for both partially and completely edentulous patients. In conventional workflow, half of the misfit is introduced during the procedures and the production of the cast, while the other half occur while manufacturing the prosthesis itself. To eliminate these errors, the concept of digital impressions was introduced. The purpose of my study was to review the available studies regarding the accuracy of the digital implant impression technique of partially edentulous arch in comparison with splinted conventional technique. I use a PICO framework, which are the patient intervention, control, outcome, to form the search strategy. The PICO question was, is the digital impression technology provide accurate results similar to those in traditional splinted impression technique? A literature search was conducted using PubMed, Google Scholar, and Cochrane Library, including articles published from 1990 up to 2020 in dental literature. I use combination of keywords, mesh, and free term words. Articles were fully analyzed and include according to the following criteria. It should in vivo or in vitro study, partially edentulous arch, splinted conventional impression, and digital impression with commercially available intraoral scanners using scan bodies, and the article should be in English. Finally, should report the accuracy assessment method. I follow the preferred reporting items for systematic review and meta-analysis, PRISMA flowchart in 3-stage selection process. In the beginning, I found 1,361 studies through different databases. At the first stage, duplicate study were removed. At the second stage, the abstracts and titles were screened. At the third stage, 31 full text were carefully analyzed and assessed for eligibility. And overall, 7 articles were identified as relevant based on inclusion and exclusion criteria. The characteristics of these articles and the different method applied for evaluating the accuracy was summarized in this table. In general, from 7 included study, 3 studies reported that the digital impressions more accurate than the splinted ones, and 1 study found no difference. 5 studies used the superimposition of the standard tessellation language, STL files, which is one of the most common methodologies to measure and compare the accuracy at the microscopic level. Some results lie in fact that it is in vitro study, which mean the conditions were close to ideal. The results vary widely based on the methodology and study design. However, Other factors such as lack of fixed anatomical landmark, type of intraoral scanners, and patient factors like presence of saliva or implant factors as implant system, inter-implant distance, or angulation, as well as the experience of both clinician and technician can influence the final accuracy and fitting. And finally, the conclusion under the limitation of the present study is, out of the 7 articles that compare digital and splinted conventional implant impression techniques, 3 articles encourage the use of intraoral scanners in the implant field, and 1 study found no difference. Since there are no reliable techniques to obtain a true reference in the clinical circumstances, further long-term prospective clinical trials are needed to confirm the effectiveness of digital impression procedures. And thank you.
Thank you, Dr. Maram, for the presentation.